What if I told you that your body has been screaming warnings at you for months or years, and you've been dismissing them as normal or just stress? From subtle symptoms to obvious red flags, we're about to expose 30 signs that your body is breaking down, and you're ignoring them until it's too late. This isn't about hypochondria. This is about recognizing when your body is failing before it becomes irreversible. Pay attention or pay the price. Sign number 1. Persistent fatigue that sleep doesn't fix. You sleep 8 to 10 hours and wake up exhausted. Coffee doesn't help. Rest doesn't restore you. This isn't normal tiredness. It's a sign that something is failing. Chronic fatigue that doesn't improve with rest indicates potential thyroid dysfunction, anemia, chronic inflammation, autoimmune disease, or early organ failure. Your body is struggling to maintain basic energy production. That exhaustion you've normalized for years, it's not just stress or aging, it's a physiological breakdown signal. When sleep doesn't restore energy, your body is screaming that something fundamental is broken. Get comprehensive blood work, thyroid, iron, inflammation markers, metabolic panel. Sign number 2, unexplained weight changes, rapid loss or gain without changing diet or exercise. Losing or gaining 10 plus pounds without changing diet or exercise is a major red flag. Your metabolism is malfunctioning or something is consuming your body's resources. Rapid weight loss can indicate diabetes, hyperthyroidism, cancer, or malabsorption disorders. Rapid weight gain suggests hypothyroidism, insulin resistance, or hormonal dysfunction. That unexplained weight change you're celebrating or stressing about, your body is telling you something is broken. Weight should be relatively stable with consistent habits. Dramatic changes without explanation mean physiological dysfunction, not luck. Sign number 3, constant thirst and frequent urination, diabetes warning. You're constantly thirsty despite drinking water. You're urinating 10 plus times daily. You wake up multiple times at night to pee. This is classic diabetes presentation. Your body is trying to flush excess blood sugar through urination, causing dehydration and constant thirst. That unquenchable thirst and constant bathroom trips, your kidneys are drowning in glucose trying to eliminate it. This is type 2 diabetes screaming at you. Get your blood sugar checked immediately. Catching it early prevents kidney failure, blindness, and amputation. Ignoring it guarantees complications. Sign number 4, persistent digestive issues. Your gut is failing. Chronic bloating, irregular bowel movements, stomach pain, or digestive distress that's become your normal isn't normal, it's dysfunction. This can indicate IBS, inflammatory bowel disease, celiac disease, gut microbiome collapse, or food intolerances that are causing systemic inflammation. That digestive chaos you've lived with for years, it's destroying your nutrient absorption, creating inflammation, and potentially signaling serious GI disease. Your gut health affects everything: brain, immune system, hormones. Persistent digestive problems aren't quirks, they're warnings. Sign number 5, brain fog and memory problems, cognitive decline starting. You can't focus, you forget words mid-sentence, you walk into rooms and forget why. You're not sharp anymore. You're experiencing early cognitive decline. This can indicate thyroid dysfunction, vitamin deficiencies, especially B12, sleep apnea, chronic inflammation, early dementia, or neurodegenerative disease. That brain fog you blame on stress or aging, it's your brain struggling to function properly. Cognitive symptoms are never just aging in people under 60. Something is impairing your brain function: inflammation, poor blood flow, nutrient deficiency, or disease process. Investigate before permanent damage occurs. Sign number 6, shortness of breath during normal activities. Climbing stairs leaves you gasping. Walking moderate distances causes breathlessness. You can't talk while walking without getting winded. Your cardiovascular or respiratory system is failing. This indicates potential heart disease, lung disease, anemia, or severe deconditioning beyond normal lack of fitness. That breathlessness doing everyday activities, your heart or lungs can't deliver adequate oxygen. This is pre-heart attack, COPD, or severe anemia territory. You shouldn't be gasping from normal activities. This is failure, not fitness. Get cardiac and pulmonary function tests immediately.
Sign number 7, persistent pain that you've gotten used to. Back pain, joint pain, headaches, or any chronic pain that's become background noise in your life isn't normal. It's your body in constant distress. Chronic pain indicates inflammation, structural damage, autoimmune disease, or progressive degeneration. That pain you've normalized, it's causing stress hormone elevation, sleep disruption, and systemic inflammation. Pain is a warning signal, not a personality trait. When you stop noticing pain because it's constant, you're in danger. Your alarm system is being ignored. Chronic pain accelerates aging and disease. Address the cause, not just the symptom. Sign number 8, changes in skin. Moles, discoloration, persistent rashes, or unexplained skin discoloration are potential cancer, autoimmune disease, or organ failure signals. Skin is your largest organ and often shows internal problems first. Yellowing, jaundice, indicates liver failure. Persistent rashes suggest autoimmune disease. Changing moles are potential melanoma. That skin issue you've been ignoring, it could be your liver, kidneys, or immune system failing. Don't dismiss skin changes as cosmetic. They're often windows into internal dysfunction.
Sign number 9, mood changes and depression that appeared without obvious cause. Sudden onset depression, anxiety, or personality changes without obvious psychological cause can indicate neurological disease, hormonal dysfunction, or nutrient deficiency. Your brain requires specific nutrients, hormones, and chemistry to function. Imbalances cause psychiatric symptoms. That depression you're treating with therapy but not investigating medically, it could be thyroid disease, vitamin D deficiency, B12 deficiency, or early Parkinson's. Mental health symptoms can be physiological problems. Rule out medical causes before accepting it as purely psychological. Sign number 10, swelling in legs, ankles, or feet. Fluid retention warning. Persistent swelling or edema in lower extremities indicates your heart or kidneys aren't managing fluid properly. This is organ failure territory. Heart failure causes fluid backup because your heart can't pump efficiently. Kidney disease causes retention because kidneys can't filter properly. Liver disease causes protein deficiency leading to fluid accumulation. That ankle swelling you're blaming on standing too long? Your organs are failing to regulate fluid balance. This is serious. Edema doesn't happen in healthy people. It's always pathological. Sign 11, chest discomfort or pressure, pre-heart attack warning. Any chest pressure, tightness, discomfort, or pain, especially with exertion, is a cardiac emergency until proven otherwise. Don't wait for the Hollywood heart attack. Heart attacks often present as pressure, squeezing, or indigestion feeling. Women especially have atypical symptoms. That chest discomfort you're ignoring, it's your heart struggling. Dismiss this and you're gambling with sudden death. ER visits for false alarms are better than dying from ignored warnings. Chest symptoms require immediate medical evaluation, not Google searches and hoping it passes. Sign 12, persistent cough or hoarseness, lung disease or throat problems. A cough lasting more than 3 to 4 weeks, especially if producing blood or accompanied by weight loss, indicates potential lung disease, cancer, or serious infection. Hoarseness lasting weeks can indicate throat cancer, vocal cord problems, or nerve damage. That chronic cough you've had for months, it's not just allergies, it's potentially lung disease or cancer. Persistent cough is never normal. It indicates chronic irritation, infection, or growth. Get chest X-ray and examination. Early detection is the difference between treatable and terminal. Sign number 13. Night sweats. Your body is fighting something. Waking up drenched in sweat, not just warm, indicates potential infection,
cancer, especially lymphoma, hormonal dysfunction, or autoimmune disease. Normal people don't soak their sheets with sweat nightly. That night sweating you blame on room temperature, your body is having internal crisis. Night sweats are classic presentation for serious diseases, combined with other symptoms, weight loss, fatigue, fever. This is medical emergency territory. Your body's thermoregulation is broken. Find out why. Sign number 14, changes in bowel movements, blood, color changes, or pattern changes. Black or tarry stools indicate GI bleeding. Bright red blood indicates lower GI bleeding. Persistent diarrhea or constipation pattern changes signal disease. Your stool is health indicator. Black stools mean you're bleeding internally. Pencil-thin stools can indicate colon cancer obstruction. Persistent changes aren't diet variations, they're pathology. That blood in your stool you've been ignoring, you're bleeding internally. This is never normal. Colon cancer is highly treatable if caught early, deadly if ignored. Any persistent stool changes or blood require colonoscopy.
Sign 15. Difficulty swallowing, esophageal or neurological problem. Progressive difficulty swallowing, dysphagia, indicates esophageal obstruction, possibly cancer, neurological disease, or structural problems. Choking on food, sensation of food stuck, or needing liquids to wash down solid food are red flags. That swallowing difficulty you've been working around, it's potentially esophageal cancer or serious neurological disease. Difficulty swallowing worsens over time as obstruction grows or disease progresses. Early intervention can save your life. This symptom demands immediate evaluation. Sign 16. Persistent headaches with new patterns. Headaches that are new, different from your usual pattern, progressively worsening, or associated with neurological symptoms can indicate brain tumor, aneurysm, or serious disease. Worst headache of your life, especially sudden onset, suggests brain bleed. Progressive headaches suggest growing mass. That new headache pattern that's different from your normal headaches, it could be your brain under pressure from tumor or bleeding. Don't dismiss new or changing headache patterns. They're not just stress, they're potential emergency neurology.
Sign 17. Vision changes, blurriness, spots, or floaters. Sudden vision changes, persistent blurriness, new floaters, or flashing lights indicate potential retinal detachment, diabetes, hypertension, or neurological problems. Gradual vision loss can indicate diabetes damaging retinal blood vessels. Sudden changes suggest retinal emergency or stroke. That blurry vision you're ignoring, it could be undiagnosed diabetes destroying your eyes or retinal detachment about to cause permanent blindness. Vision changes demand immediate evaluation. You can't get your sight back after it's gone. Sign 18. Numbness or tingling in extremities, nerve damage. Persistent numbness, tingling, or pins and needles in hands or feet indicates nerve damage from diabetes, vitamin B12 deficiency, or neurological disease. Peripheral neuropathy is often first sign of uncontrolled diabetes. It's permanent nerve damage that progressively worsens. That numbness in your feet you've been living with, you're experiencing nerve death from disease. This progresses to complete numbness, balance problems, and injuries you don't feel. Catch the cause early or lose sensation permanently.
Sign 19. Unexplained bruising or bleeding, blood disorder. Easy bruising, prolonged bleeding from small cuts, or spontaneous bruising without injury indicates potential blood clotting disorder, liver disease, or blood cancer. Your blood should clot normally. Excessive bruising means clotting factors are low or platelets are dysfunctional. That easy bruising you chalk up to thin skin, it's potentially leukemia, liver failure, or clotting disorder. Blood abnormalities are serious. They can cause internal bleeding or indicate cancers. Any abnormal bruising or bleeding requires blood work immediately. Sign 20. Persistent low-grade fever, chronic infection or disease. Fever that persists for weeks, even if mild, 99 to 101 degrees Fahrenheit, indicates chronic infection,
autoimmune disease, or cancer. Your body doesn't run fever for no reason. Persistent elevation means immune system is fighting something continuously. That low fever you've had for weeks, it's not just run down. Your body is in constant battle mode. This indicates ongoing infection, inflammatory disease, or cancer, especially lymphoma. Fever lasting more than a few days requires investigation. Sign 21. Hair loss beyond normal shedding. Sudden hair loss, patches of baldness, or dramatically increased shedding indicates hormonal dysfunction, autoimmune disease, alopecia, or severe stress or illness. Normal people don't lose handfuls of hair. That hair loss you're stressing about, it's your body diverting resources from non-essential functions because it's in crisis mode. Hair loss indicates thyroid disease, severe nutritional deficiency, autoimmune attack, or systemic illness. Your body sacrifices hair when it's fighting to survive. Find out what it's fighting. Sign 22. Cold hands and feet despite warm environment. Persistently cold extremities indicate poor circulation from heart disease, peripheral artery disease, hypothyroidism, or Raynaud's disease. Your circulatory system should deliver warm blood to extremities. That constant cold hands or feet problem, your circulation is failing. This can indicate heart disease or arterial blockages. Poor circulation leads to tissue damage, infections that don't heal, and potential amputation if arterial disease progresses. Cold extremities aren't just uncomfortable, they're warning your cardiovascular system is compromised. Sign 23. Dizziness or lightheadedness upon standing, blood pressure or heart issues. Orthostatic hypotension, dizziness when standing, indicates blood pressure regulation failure, dehydration, heart problems, or neurological dysfunction. Your body should maintain blood pressure when position changes. That head rush when you stand, your cardiovascular system can't compensate properly. This indicates autonomic dysfunction, heart failure, severe dehydration, or blood pressure medication issues. Standing shouldn't cause dizziness. This is cardiovascular failure to adapt. It can cause falls and injury. Address the underlying cause. Sign 24. Persistent nausea without explanation. Chronic nausea indicates GI disease, liver disease, kidney disease, pregnancy, or brain issues, tumors or migraines. Your body doesn't create nausea for fun. That persistent queasy feeling, something is broken. Digestive system, kidneys filtering toxins poorly, liver failing, or brain sending wrong signals. Weeks of nausea require investigation. You're either not digesting properly, accumulating toxins, or have neurological dysfunction. Find the cause before it progresses to organ failure. Sign 25. Sleep pattern disruptions, insomnia that won't resolve, or sleeping 12+ hours and still tired. Sudden sleep pattern changes, insomnia that won't resolve, or sleeping 12+ hours and still tired indicate depression, hormonal issues, or neurological problems. Sleep architecture reflects brain health. Disruption suggests brain chemistry is off. That new insomnia or excessive sleep, it's not just stress, it's potentially thyroid disease, depression with physiological cause, sleep apnea, or early dementia. Sleep changes are brain dysfunction signals. Investigate medical causes before accepting it as purely behavioral. Sign 26. Tremors or muscle twitching. Involuntary tremors, muscle twitching, fasciculations, or shakiness indicates potential Parkinson's, essential tremor, neurological disease, or severe magnesium or electrolyte imbalance. Your muscles shouldn't move without your control. That hand tremor or muscle twitching, it's neurological dysfunction. This can be early Parkinson's, nerve disease, or severe magnesium or electrolyte imbalance. Neurological symptoms progressively worsen. Early intervention is critical. Don't dismiss tremors as stress or caffeine. They're nerve signals misfiring. Sign 27. Jaw pain or tooth pain that isn't dental. Jaw pain, especially during exertion, can indicate heart disease. Tooth pain without dental cause can indicate sinus infection, nerve problems, or referred cardiac pain. Heart attacks often present as jaw or tooth pain, especially in women. That jaw discomfort during exercise? It could be your heart struggling, not TMJ. Any unexplained jaw or tooth pain, especially with exertion or accompanied by other symptoms like fatigue or shortness of breath, requires cardiac evaluation. Don't let heart disease masquerade as dental problems until it's too late. Sign 28. Changes in urination color or smell. Dark urine indicates dehydration or liver disease, brown urine from bilirubin. Foamy urine indicates protein in urine from kidney disease. Strong smell indicates infection or diabetes. Your urine should be pale yellow and mostly odorless. That dark, foamy, or foul-smelling urine, your kidneys are failing or you have infection or diabetes. Brown urine means liver is dumping bilirubin, liver failure territory. Foamy urine means kidney filters are damaged and leaking protein. These are serious warnings. Urine changes aren't normal variations, they're pathology indicators.
Sign number 29. Loss of appetite or early satiety. Losing interest in food or feeling full after just a few bites indicates potential GI obstruction, cancer, depression, or metabolic disease. Your appetite regulates based on energy needs. Persistent loss suggests body isn't signaling needs properly or something is blocking digestion. That appetite loss you're not concerned about? It could be cancer causing early satiety, depression with physiological component, or GI disease. Unintentional appetite changes warrant investigation. Your body's energy regulation is malfunctioning. Sign number 30. Ignoring all these signs because I feel fine otherwise. The most dangerous sign, dismissing symptoms because they're not debilitating yet. Early disease is subtle. By the time you feel really sick, you're often in advanced stages. Your body gives subtle warnings before screaming. That attitude of, I'll wait until it gets worse, you're waiting until it's too late to easily fix. Cancer, diabetes, heart disease, all are most treatable early when symptoms are mild. That collection of minor symptoms you're ignoring, they're your body's desperate attempt to warn you before catastrophic failure. Don't wait for the crisis to address the warnings.
So there you have it. 30 warning signs your body is breaking down that you've been dismissing as normal, stress, or aging. Your body doesn't malfunction for no reason. Every symptom is communication. Every persistent problem is a red flag. The earlier you catch disease, the more treatable it is. Ignoring warnings doesn't make problems disappear. It lets them progress to irreversible stages. Your body is talking to you constantly. The question is, are you listening? Which of these signs do you have right now? How many have you been ignoring? Drop your honest assessment in the comments. And if this video just made you realize you need to see a doctor, hit that like button and subscribe, because your health isn't guaranteed, and symptoms don't get better by being ignored. Listen to your body before it stops warning you and just fails. Early intervention saves lives. Denial kills. Disclaimer: this video is educational information, not medical advice. See a healthcare professional for any concerning symptoms. Better to overreact to nothing than ignore something serious.